In this chapter, we're going to focus Addison disease and Cushing syndrome. Basically, this portion of PowerPoint, we are going to discuss about what is Addison disease, what are the cause, what are the sign and symptom, and nursing care and complication of the Addison disease. After the Addison disease, we are going to focus what are the cause of Cushing syndrome or sign and symptom, laboratory test, diagnosis, nursing care, and also medication. If you really want to know about these two diseases, first of all, we should talk about some anatomy, because Addison disease and Cushing syndrome both are the disorder of adrenal gland. This is the adrenal gland. Other name is called suprarenal gland. The adrenal gland has two anatomical or histological part. If you cut this adrenal gland, you can get outer layer cortex and inner layer medulla. Outer layer secrete three hormones like mineralocorticoid, glucocorticoid, and sex hormone named androgen. Inner layer or medulla secrete epinephrine or norepinephrine. The Addison disease or Cushing syndrome, this is the disease of adrenal cortex area. So in this table showing the adrenal cortex has the two diseases basically, Addison and Cushing, right? So if this adrenal cortex hypersecretion of the hormone, that disease causes Cushing. If the inadequate secretion of the hormone by adrenal cortex, it is the outer layer cortex, inadequate secretion of aldosterone, cortisol, or sex hormone, we say Addison disease. So inadequate, or when the secretion is decreased, Addison. So the spelling of Addison, A double D. D stand for down. A double D I S O N, Addison. There are too many D, and D stand for down. So when adrenal cortex secretion is down, reduce or inadequate secretion of hormone by adrenal cortex, or when decrease the aldosterone, cortisol, or sex hormone, the disease develop Addison disease. On the other hand, the Cushing syndrome, I told you, Cushing, C, U for up, right? So overproduction or up, too much production of cortisol by adrenal cortex outer layer and causes the Cushing syndrome. Pherecytoma, the inner part of adrenal gland, they secrete epinephrine or norepinephrine. If too much secretion of epinephrine or norepinephrine by adrenal medulla, patient develop pheromocytoma. So what wrote in this picture, let me read it. Addison disease develops when the level of adrenal cortex hormone is low due to hyposecretion, right? So what are the cause of hyposecretion? Let me explain, right? So the hyposecretion may be the primary adrenocortical insufficiency, means damage or dysfunction of adrenal cortex, or secondary cause, secondary adrenal insufficiency, because pituitary tumor or any hypophyseectomy. So in this picture, we can see in the picture showing all of the endocrine gland in the body, adrenal cortex insufficiency, this is the primary cause, primary adrenal insufficiency. Let me read inside. Also known as Addison disease, refer to hyposecretion of adrenal cortex hormone. So if I ask you, what are the hormones secreted by adrenal cortex? You can answer glucocorticoid, mineralocorticoid, and androgen. Androgen are sex hormone. So these hormones has important role in metabolism. They also, androgen help to distinguish between man and female, right? If any patient is diagnosed by Addison disease, it is very important, keep it in mind, they have to require lifelong replacement of glucocorticoid therapies, right? They need to lifelong requirements. The secondary cause here, secondary adrenal insufficiency, are the pituitary tumor or hypophyseectomy. What next? In this picture, little bit explain little bit more, or I could repeat it. Adrenal cortex insufficiency or Addison disease. In this picture, showing the histology of adrenal gland, inner side is medulla and outermost cortex. The cortex again subdivided into three layers. Okay, one is called glomerulosa, fasciculata, and reticularis. These three layers together is called cortex. They secrete basically aldosterone, cortisol, and sex hormone. In Addison disease, loss of mineralocorticoid or aldosterone that lead to sign and symptom. What are the sign and symptom? The Addison disease sign and symptom: weight loss or hyperpigmentation in the body, and this is called bronze skin. This is the question in NCLEX board asks. Or patient feel lethargy, nausea, vomiting, or hypotension or dehydration. So just here we wrote very few what is essential for our board exam: dehydration, hypotension, hyponatremia, and hyperkalemia. So Addison, I said D for down, all of the secretion of the hormone is go down, and most of the sign and symptom also down, like hypotension, blood pressure go down, hyponatremia, sodium level go down, dehydration means fluid volume go down, but exception is hyperkalemia, right? So the hyponatremia or hyperkalemia, this is the laboratory values, lab values, right? So if I ask you what are the lab values of Addison disease, you can answer me increase the potassium level, and some books say increase the calcium level, but decrease sodium, decrease glucose, decrease cortisol, right? So next here, same picture showing little bit bigger. The first picture, the kidney, at the top of the kidney, adrenal gland or suprarenal gland. The internal site or histology in the second picture that I explained a little bit ago, in here showing the inner layer medulla, what is secret epinephrine, norepinephrine. If any tumor occurred in the medulla and secretion of medulla is increase, means epinephrine increase, norepinephrine increase, and patient suffer by malignant hypertension and headache, and this is called pherecytoma. The cortex outer layer contain 3 layers, and they secrete like glomerulosa, they secrete glucocorticoid, shortly called cortisol, or mineralocorticoid, shortly called aldosterone, and sex hormone, shortly called androgen or testosterone, right? And here showing the sign and symptom of adrenal cortex insufficiency or Addison disease. So just give a focus here, the picture number 1, the pigmented on the nail, pigmented on the crease, and here pigmented in the gum. So let me read it. Note the here generalized skin pigmentation, right? But especially in the deposition of pigment in flower skin crease, also in the gum or nail bed. What next? What are the nursing intervention? Before to go nursing intervention, I wrote something beside. In Addison disease, you see, electrolyte is important. But here I said potassium level go up, calcium level should go up, but sodium level should go down. Glucose level should go down. Cortisol level should go down, but WBC should go up. So if here, if I make, I said the potassium, calcium, WBC, and magnesium, these 4 go up, exceptional. But glucose or sodium or cortisol go down in Addison disease. So what is the intervention? Monitor the vital sign, monitor the white blood cell, right? White blood cell go up, and it also admin the glucocorticoids or mineralocorticoids, because glucocorticoid and mineralocorticoid supposed to go down. Also, when you deal with the patient who diagnosed by Addison disease, we could monitor for signs, symptom of Addisonian crisis, right? So if I told you what are the diagnosis of the patient, basically we can check electrolyte and ACTH. It is called ACTH stimulation test. So what next? What are the intervention and nursing care or client education? So need for, we could educate our patient, they need to take this medication lifelong, or corticosteroid replacement therapy important. It is good if they avoid the infection, avoid any vigorous exercise, and also avoid over-the-counter medication. So in a short, I want to recap it, the nursing care. We admin or administer the steroid, because in Addison disease, steroid go down. What steroid we give them? We give them hydrocortisone or prednisolone. We admin the fluid electrolyte as prescribed. Also, we could treat the hyperkalemia, sodium polystyrsulfonate we give them, or insulin we should give. Also treat the hypoglycemia. The complication arise by the Addison disease. The complication combinedly we ask Addisonian crisis. So we encouraging the patient wear the medical alert bracelet, and also if we see any sign of symptom of the Addisonian crisis, we have to notify to the healthcare provider, right? So what I wrote, report the sign and symptom of the complication such as under replacement and over replace glucocorticoid. Also, we have to check the complication of Addisonian crisis. So now question come, what are the sign and symptom of Addisonian crisis? Addisonian crisis is a life-threatening disorder caused by acute exacerbation of adrenal insufficiency. Usually, if any Addison patient is precipitated by stress or infection, any trauma or surgery, or any abrupt withdrawal of exogenous corticosteroid. Exogenous means if you give something from outsource, can cause the complication. What complication? Like hyponatremia or hyperkalemia, hypoglycemia, all of these lead to the shock. So in Addisonian crisis, the data collection or sign and symptom are very rapid onset, or this is a medical emergency due to infection or trauma or any abrupt discontinuation of the steroid. What are the common sign and symptom Addison crisis? We wrote on the bottom. Heavy headache, severe abdominal pain, leg pain, low back pain, generalized weakness, irritabilities, confusion, and severe hypotension. If we do not treat hypotension, it leads to the shock, right? So management of the shock is important. What are the nursing care if patient has Addisonian crisis? As I told you, this is the medical emergency because very rapid onset of Addison crisis. So we have to prepare to assist RN, also monitor the vital sign, particularly blood pressure, because Addison crisis patient easily develop hypotension and that lead to the shock. Monitor the neurological status, monitor input-output chat, monitor the laboratory values, because potassium level go up, calcium level go up, magnesium level go up. On the other hand, sodium level go down, glucose go down, cortisol go down. So laboratory values is really important. Also monitor the IV fluid. Also protect the client from infection. So Cushing syndrome, we are going to talk here. So as already we discussed in the beginning of this PowerPoint, the Cushing, Cu means up, means overproduction of cortisol by adrenal cortex. So let me read what is wrote here. A metabolic disorder resulting from a chronic and excessive production of cortisol by adrenal cortex, right? Or from administration of glucocorticoid in a large dose. Suppose someone is treated by glucocorticoid, but if you take too much glucocorticoid for a long time, you chance to develop Cushing syndrome. Another cause, acetate secretion tumor. So, my friend, Cushing syndrome causes primary and secondary. The primary means adrenal dysfunction, means adrenal gland dysfunction. This is the adrenal gland, right? So if this adrenal gland or suprarenal gland overproduction of cortisol by adrenal cortex, patient develop Cushing. Secondary cause, we said the pituitary gland. So this is the pituitary gland. If any tumor in the pituitary gland and pituitary dysfunction, overproduction of ACTH by anterior pituitary also can causes Cushing syndrome, and this is the secondary cause. Another cause, I said here, administration of glucocorticoid. So long-term use of steroid or chronic condition can cause Cushing. So, what is Cushing disease? Cushing disease is a metabolic disorder characterized by abnormally increase the secretion of cortisol or causes by increase the amount of ACTH secreted by pituitary glands, right? In this picture showing some pathology, I already explained if pituitary gland overproduction of ACTH work on the outer cortex and outer cortex secrete too much cortisol and causes Cushing. Another here, if the outer layer of cortex causes the tumor or overproduction or dysfunction, secretion too much cortisol, develop the Cushing. Picture number 3 here, if anybody long-term use of steroid for any chronic condition, steroid, chance of develop Cushing syndrome. And in this picture showing if someone are paraneoplastic, tumor in the lungs, secret ACTH and ACTH work on the outer layer of cortex and developed Cushing syndrome. This is the for picture what is develop or lead to develop Cushing disease or Cushing syndrome. In this picture showing some sign and symptom. This boy is normal, but this boy face is look like, you see, moon face, right? So if anybody have a Cushing, they gain weight gain, moon face, buffalo hump, increased abdominal grade, all of the sign of the Cushing. In this picture showing from head to toe the sign and symptom. Let me read it. So central nervous system irritabilities, hypertension, but in Addison, hypotension, cardiac hypertrophy, hyperplasia, right? Or some try on the lower abdomen, skin ulcer, muscle wasting, osteoporosis, and obesity. This is the sign of Cushing syndrome. In this picture, is typical picture showing the sign and symptom. The typical appearance of a Cushing syndrome. The face is moon face, buffalo hump, means extra fat on the shoulder, increase the abdominal gait, right? Or truncal obesity. So this picture of this respected lady, her two arms and legs is thinner, no fat on the buttock, but her fat on the abdomen, right? Truncal obesity. In this patient also increase the infection, right? Their skin is thin and fragile. They have developed edema, weight gain, or hypertension, tachycardia, bones pain or easily fracture, hyperglycemia, gastric ulcer, or also another most important sign, hirsutism. They develop hirsutism, right? If you go in the laboratory test, we can see the elevate the cortisol level or increase the glucose or sodium level, but decrease potassium and calcium level, opposite of Addison. Intervention: monitor the vital sign, monitor input output, monitor laboratory values, particularly white blood cell count, right? Or serum glucose, sodium, potassium, and calcium. So I said in this Cushing syndrome patient, cortisol level go up, glucose level go up, sodium level go up, but potassium level go down, calcium level go down. Also, admin chemotherapies means treatment and prepare the client for radiation therapy as needed, right? So what are the nursing care? So intervention first. Basically, a question sometimes NCLEX board asks, how we diagnose it? The diagnostic tests are called dexamethasone suppression test. NCLEX board asks this question. But nursing intervention is super important for us. Like prepare the client for remove the pituitary tumor. And this is called hypophyseectomy or sublabial transsphenoidal adenectomy. This is the surgical treatment name, sublabial transsphenoidal. Okay. So prepare the client for adrenalectomy, means adrenal gland cut and remove. Also, client require, if adrenalectomy is done, patient need lifelong glucocorticoid replacement. So if patient have done this kind of surgery, we need a special care for the patient. Especially the diet is important. We provide the diet, decrease the sodium intake or increase the intake of potassium, calcium, and protein. Also maintain the safe environment due to increase the risks of fracture. Prevent infection is important. Protect the patient skin from breakdown. Sometimes we give some medication called ketoconazole or adrenal corticosteroid inhibitor or spironolactone. It is potassium sparing diuretics. So here is the one note is very important. It's called Addison's disease is characterized by hyposecretion of adrenal cortex hormone, whereas Cushing disease is characterized by hypersecretion, right? Now we are going to compare and contrast in between these two, Addison and Cushing. Compare and contrast, right? I do not take too much time from you, but let me share something. In Addison down, right? Cushing, see U means up. Am I correct? So the down, patient feel fatigue, lethargy, muscle weakness. Can you find out something is down? If anybody easily get tired, it's down. Easily get lethargy, it's down. Muscle weakness, down. Gastrointestinal disturbance, weight loss, down. Weight loss. Menstrual change in the women, hypoglycemia, glucose down. Hyponatremia, sodium down. But some are exceptional as well. Hypotension, blood pressure down. What is exceptional? Hyperkalemia and hypercalcemia. Another question NCLEX would ask that Addison disease most of the times chance of develop hyperpigmentation of the skin, and skin is look like the bronze skin. Very important for NCLEX board. Where is the Cushing disease or syndrome? I said everything is go up, but major sign I will already explain: moon face, buffalo hump, truncal obesity, thin to upper extremity to lower extremity, and female patient look like hirsutism. I said a female is beautiful because she's female, right? And I said if a female look like a man, muscular, female talk very sweet voice, but they talk a wild voice like a man. Definitely, a female look like a man, muscular. This is not, somebody do not like it, and it's a hirsutism. And Cushing patient sometimes have a problem of hirsutism. Or I said everything go up: hyperglycemia, hypernatremia, hypertension. Exception: hypokalemia, hypocalcemia. The other sign is a fragile skin, easily bruising, reddish purple striae on the abdomen, this area. So if you read and compare and contrast, it is easy to remember. Something is more, I wrote it here, gather here. I said Addison, D, you see, up, underline the D, down, Cushing, up. So it is called adrenal insufficiency, inadequacy. Go down the secretion of adrenal cortex. Also, ACTH deficit, where the Cushing adrenal cortex secretion go up, cortisol go up, or ACTH excess. The sign here: bronze skin, discoloration, muscle weakness, lethargy, dizziness, vomiting, weight loss, and GI upset, right? So bronze skin, this is the NCLEX borax. Here, the Cushing, mood switching, hypertension, buffalo hump, moon face, weight gain, but weight loss, down, up, weight gain, metabolic alkalosis, pathological fracture, right? I put this note together because of this box. All is decrease, who they are. Blood pressure decrease, sodium level decrease, glucose level decrease, hypoglycemia, temperature decrease, right? Whereas in the Cushing syndrome, WBC decrease, potassium decrease, magnesium decrease, but they are increased. So increase in case of exceptional down, potassium, magnesium, WBC, and calcium. Whereas the Cushing, exceptional facial hair growth, hirsutism, gynecomastia in case of men, glucose level go up, RBC go up, sodium go up. So the last information I want to share with you, in adrenal gland help to make adrenalism and cortisol. So Addison disease, the sign and symptom, kind of hypothyroidism. Let me recap it. I said Addison disease, most of the sign and symptom, kind of hypothyroidism, right? It is important you should know that adrenal glands help us to deal with the stress. Deal with the stress. So if anybody's imbalance of adrenal gland, we do not deal with the stress. So in Addison disease, basically too little steroid hormone or too little secretion by adrenal cortex. So if it is too little, we need the treatment, something replace. So replace the cortisol or cortisone or prednisolone. Whereas the Cushing syndrome, basically too much secretion by adrenal cortex. So right now, I am going to tell you something important. The Cushing syndrome is immunocompromised patient. If anybody has a Cushing, it is an immunocompromised patient. So infection is more common in Cushing patient. So they need isolate room and they need private room. And also avoid putting some gift like flower, fish in a water tap in the room, better to avoid. Not allow the randomly visitors in case of Cushing, because it is the easily they get attacked, right? If you ask me why they easily get attacked, because WBC go down. When less WBC, easily attack the infection. What are the next treatment? Just let me read it. In Addison disease, they need quiet environment. They need increase the sodium in the diet because sodium level go down. Decrease the potassium because potassium level go up. Also, we have to monitor everyday body weight. Observe for the sign of Addisonian crisis. What is Addisonian crisis? Severe hypotension. What is lead to shock? And if you do not treatment, shock patient will die. So also treat with a bed rest IV cortisone. So treat the patient to carry injectable cortisone at all the time and wear medical blood bracelet. The Cushing disease provide discomfortness, decrease the sodium in diet, increase potassium in diet, opposite, monitor the glucose, observe mood, maintain input-output, decrease potassium, decrease calories, right? So this is the basic note about Addison and Cushing. It is super important for NCLEX board exam.